Hey, welcome back to our channel, where we provide everything you should know about your health. Have you ever lost a relative to cancer? One of those diseases that causes unbearable pain, that forces families to cling to faith when medicine feels powerless, that drains savings, tests patience, and breaks hearts. If you have, you know the helplessness, the hospital visits, the endless medications, and the nights of prayers and tears. Even if you haven't, chances are you know someone who has. Because cancer doesn't respect age, gender, or background. It cuts across every border, every race, and every class. Cancer is not just a disease, it is a thief. It steals fathers and mothers, brothers and sisters, friends and neighbors. It takes dreams, futures, and sometimes hope itself. Every year, more than 10 million people around the world are diagnosed with cancer, and more than 9 million die from it. That's like wiping out an entire city every single year. In fact, based on the 2024 data from the WHO Global Health Estimates, cancer kills more people annually than malaria, tuberculosis, and HIV combined. You can imagine that. But here's the most frightening part. In many cases, cancer grows silently. By the time it appears, it's often too late, leaving patients with fewer options and families with more difficult decisions. So what exactly makes cancer so deadly? Why do some types kill more people than others? And how can we fight back? In this video, we will take a deep dive into the 10 deadliest cancers in the world based on the number of deaths they have caused, counting down from the least to the most fatal. We'll talk about what makes each one dangerous, the symptoms we often overlook, the risk factors, and the hope that modern science is bringing. We'll hear about cancers that creep up slowly, like prostate cancer, and those that strike aggressively, like pancreatic and lung cancer. We'll reveal why some cancers are more common in certain parts of the world, and why survival rates are so different between countries. And as we go through this countdown, I want you to remember that behind every statistic is a story, a human being, someone who once laughed, loved, dreamed, and mattered. Cancer is not just numbers, it's personal. So, whether you face cancer yourself, walked beside a loved one through it, or simply want to understand this enemy better, stay with us. Because the more we know, the better prepared we are to fight back. Before we start, what exactly is cancer? Put simply, cancer happens when the body's cells start growing out of control, forming lumps or spreading to parts of the body where they don't belong. Normally, our cells grow, divide, and eventually die in a very orderly way. Unlike normal cells that follow rules, cancer cells don't stop growing. They grow uncontrollably, invading tissues and organs as they spread. What makes cancer so deadly is not just the growth itself, but how silently it develops. Many people don't realize they have it until it's too late. By then, treatment becomes more complicated, survival chances drop, and families are left devastated. Some cancers are linked to genetics, lifestyle choices, such as smoking, too much alcohol, unhealthy diets, or lack of exercise. Others come from environmental exposures, like too much UV radiation from the sun or harmful chemicals. As we progress, please note that our statistics are based on 2022 data from the WHO's International Agency for Research on Cancer, IARC, published in 2024. Now that you understand what cancer is and how it starts, let's begin our countdown. Number 10, leukemia. Have you ever imagined what it feels like when our own blood, the very essence of life, turns against us? That's how cruel leukemia can be. This type of cancer begins in the bone marrow, the soft, spongy tissue inside our bones that produces blood cells. Instead of producing healthy white blood cells, which normally fight infections, the bone marrow starts producing abnormal, immature cells. In this case, the abnormal, immature cells crowd out healthy blood cells, weaken the immune system, and disrupt the balance of oxygen-carrying red blood cells and clot-forming platelets. In other words, leukemia is cancer of the blood. Now that we understand what leukemia is, why is it so dangerous? Unlike solid tumors that grow in a single organ, leukemia spreads through the bloodstream, giving it access to the entire body from the very beginning. It weakens the immune system, making the body defenseless against simple infections. And because it disrupts blood production, patients may bleed easily, bruise often, or feel overwhelming fatigue. That's not all. A major concern is that leukemia attacks silently. Many patients overlook the first signs and see them as minor problems. The signs can include night sweats, unexplained fevers, or bone pain. By the time a diagnosis is made, the disease may already be advanced. Now, let's look at the mortality rate. According to the World Health Organization, leukemia causes around 300,000 deaths each year worldwide. It accounts for nearly 3% of all cancer deaths. Although survival rates have improved over the years, the outlook still depends heavily on the type of leukemia and the age of the patient. Here are the common types of leukemia. Acute lymphocytic leukemia, ALL, which is the most common type of leukemia in children, teens, and young adults up to age 39. Acute myelogenous leukemia, AML, which is the most common type of acute leukemia in adults. It's more common in older adults. Chronic lymphocytic leukemia, CLL. This type is the most common chronic leukemia in adults, most common in people over 65. Symptoms may not appear for several years. Chronic myelogenous leukemia, CML. It is more common in older adults too, and rarely occurs in children. In children with acute lymphoblastic leukemia, cure rates can reach 85 to 90% in developed countries. But in older people with acute myeloid leukemia, the 5-year survival rate drops below 30%. But what causes leukemia? Unlike lung or stomach cancer, lifestyle choices are less to blame here. Instead, risk factors include exposure to high doses of radiation, certain chemotherapy drugs used for previous cancers, and long-term exposure to industrial chemicals like benzene. Not only that, genetics also plays a role. Children with Down syndrome, for example, are at higher risk, and age matters too. While some leukemias strike mostly in children, others are far more common in older adults, as we previously explained. This brings us to most of the treatment challenges. Treating leukemia is complicated. Because the disease lives in the blood and bone marrow, surgery isn't an option. Instead, treatment often relies on chemotherapy, radiation, targeted drugs, or bone marrow transplants. But these treatments come with immense challenges. Chemotherapy can wipe out the immune system, leaving patients vulnerable to infections. Transplants require a donor match, which is not always easy to find. And in many low and middle income countries, the high cost of care puts treatment out of reach for many families. So while modern medicine has made strides, the fight is far from equal across the globe. But this doesn't mean that all hope is lost. There have been improvements in targeted therapies, like tyrosine kinase inhibitors for chronic myeloid leukemia. These therapies have transformed what was once a death sentence into a manageable condition. Some patients now live near normal lifespans with daily pills. That is not all. Immunotherapy, especially the chimeric antigen receptors, CAR, T-cell therapy, where a patient's own immune cells are reprogrammed to attack leukemia, is offering impressive results, even in cases where other treatments fail. Here is how it works. These breakthroughs are proof that science is not standing still, but they also remind us how much more work lies ahead to make these treatments affordable and available to everyone, not just the rich. Number 9, cervical cancer. At number 9, we have a cancer that's deeply tied to women's health. Before we go on, let's understand what a cervix is. It is a small passage connecting the uterus, also known as the womb, to the vagina. The cervix facilitates the entry of sperm for fertility, protects the uterus from infection with its mucus plug, retains the fetus during pregnancy, and dilates and softens to allow childbirth. We can see how important the cervix is in women. Most of the time, it rarely gets attention until something goes wrong. Cervical cancer begins when abnormal cells start growing uncontrollably in this area, most often triggered by infection with the human papillomavirus, HPV. Now here's the catch. HPV is incredibly common. Most of the time, the body fights it off without one even knowing. But in some cases, it lingers, silently changing the cervix over the years until cancer develops. The part that really hurts is that this cancer is one of the few cancers we can actually prevent. Yet it still kills hundreds of thousands of women every year. Why is it dangerous? Well, there may be a lot of other reasons, but cervical cancer is so sneaky. In the early stages, there are usually no symptoms at all. A woman can feel completely fine, going to work, taking care of her kids, living her life, not knowing that something serious is happening inside her body. By the time warning signs appear, the cancer is often already advanced. At that stage, treatment is much harder, survival chances are lower, and the options are fewer. You may wonder what the warning signs are. They include unusual bleeding, pain during sex, or pelvic pain. So, don't overlook them. Do not be like many women who ignore or hide these symptoms. Sometimes it might be the fear of speaking out. Sometimes it's a lack of awareness. And sometimes it's simply because there's no doctor nearby to turn to. Now, here are some devastating statistics. Each year, nearly 350,000 women die from cervical cancer. That's about 1,000 women every single day. And behind every one of those numbers is a family losing a mother, a sister, a daughter, or a friend. Globally, cervical cancer is the fourth most common cancer in women. But in poorer countries, it's often the second most common and a leading cause of cancer deaths. Why? Because access to pap smears, HPV tests, and vaccines is still far from equal. Do you know that if the condition is caught early through screening, the 5-year survival rate can be more than 60 to 70%? But if detected late, that number can fall to below 20%. This means that if it is detected early, about 60 to 70% of the people with the condition would still be alive after a period of 5 years. Just think of the lives that could be saved if everyone had access to early detection. Let's take a minute to look at some of the risk factors. Persistent HPV infection is the #1 factor, but it's not the only one. Women with a weakened immune system, like those living with HIV, are also at higher risk. This might be shocking, but do you know that having many pregnancies or using birth control pills for a long time can also increase the risk slightly? And then there's the biggest risk of all, which is lack of screening. In many parts of the world, women may live their entire lives without ever having a pap smear or HPV test. Imagine going your whole life without ever being checked for a disease that could silently kill you. That's devastating. So here's the question. If cervical cancer is preventable and treatable when found early, why are so many women still dying? Here is the catch. Early-stage cervical cancer can often be treated with surgery or targeted therapies. However, once it spreads into the pelvis or beyond, treatment becomes significantly more complicated. Radiation and chemotherapy may help, but the chances of a cure are much lower. And for women in countries with fewer resources, treatment may not even be an option. Hospitals might lack the equipment, the medicines, or the specialists needed. For them, the diagnosis itself can feel like a death sentence. Having said that, let's look at the notable research advances. Cervical cancer is one of the few cancers we know how to prevent. There is availability of the HPV vaccine, which protects against the strains that cause most cervical cancer cases. This is a very good way to protect yourself and your loved ones. If you have not been vaccinated, you should consider doing so to stay safe. To help prevent deaths from cervical cancer, you can also encourage your colleagues, family members, and friends to get vaccinated. In addition to the vaccine, regular pap smears and HPV tests can catch changes long before they turn into cancer. The World Health Organization has even set a goal to eliminate cervical cancer as a public health problem within this century. That might sound ambitious, but with vaccination, screening, and treatment, it's possible. We want a future where no woman dies from a disease we already know how to stop. Number 8. Prostate cancer. At number 8, we arrive at a cancer that too often creeps into men's lives quietly. Before we move on, let's understand what the prostate gland is. It's a small gland, about the size of a walnut, located just below the bladder. The primary function of this gland is to produce prostatic fluid, a component of semen, which nourishes and protects sperm. This fluid also helps semen move more easily and supports fertilization. The prostate gland has muscles too that help control urine flow and forcefully expel semen during ejaculation. Now that we have a clear picture of the prostate gland, let's look at how it can become cancerous. But before that, let's differentiate prostate cancer from prostate enlargement, also known as benign prostate enlargement, BPH, because many people confuse the two. BPH is a condition that affects most men as they age. In fact, it's almost a normal part of the aging process. It is the gradual growth of the prostate over the years. As it expands, it begins to compress the urethra, the pipe through which urine passes. This is why an older man might find himself waking up multiple times at night to pee, having a weak stream, or feeling like his bladder is never truly empty. Although it can be very frustrating, the key thing to note is that BPH is not cancer. It's a nuisance, but it won't spread to other parts of the body. So, prostate cancer is an entirely different story. Instead of the entire gland simply enlarging, cancerous cells begin to grow uncontrollably and can also spread to other parts of the body. In its early stages, this troublemaker is often very quiet. It usually doesn't cause any symptoms. You won't feel sick, you won't feel pain, and your urination might be perfectly normal. This is the biggest challenge. A man can feel perfectly fine on the outside, while a serious problem is developing on the inside. So, what truly makes prostate cancer dangerous and different from simple enlargement is the spreading. While enlargement stays put, a cancerous growth can break free from the prostate gland and travel through the body to set up camp in other places, most commonly in the bones. When this happens, it becomes much harder to treat and can become life-threatening. The goal is always to find this cancer long before it even thinks about spreading. This brings us to the most important point I want you to take away today. If you are a man over the age of 40, do not guess and do not be afraid. Don't just assume that waking up at night to pee is just old age. Talk to a doctor about prostate screening. It's a simple conversation that can lead to simple tests. Doctors use a simple blood test called prostate-specific antigen, PSA, and a digital rectal exam to check for early changes. If these suggest something abnormal, further confirmatory tests like MRI scans or prostate biopsy can tell if cancer is present and how aggressive it is. Catching it at this stage can mean easier and more effective treatment. Taking that step is one of the strongest things you can do for yourself and for the family that depends on you. Your health is your wealth. Please take care of it. Now, here are some shocking stats. Each year, prostate cancer takes nearly 400,000 men worldwide. To put that in perspective, that's equivalent to wiping out the entire population of a city the size of Miami every single year. And while survival rates are improving in countries with strong healthcare systems, the reality is far harsher in low and middle-income nations, where screening and treatment aren't always accessible. So, who's most at risk? Age is the biggest factor. Most cases happen in men over 40, but that's not all. If your father or brother has had prostate cancer, your chances go up significantly. Ethnicity also play a role because African and Caribbean men are at even higher risk, and researchers still don't fully know why. Lifestyle matters too. Diets heavy in red meat, obesity, and lack of physical activity can all increase risk. And Sometimes, men with no obvious risk factors can still get it, which makes it all the more unpredictable. This takes us to the challenges of treatment. One of the biggest hurdles with prostate cancer is its two-faced nature. Some tumors grow very slowly and may never threaten a man's life, while others are aggressive and spread quickly to bones and other organs. How do doctors decide whether to treat immediately or to monitor and wait? That uncertainty can leave patients and families in limbo, caught between fear and hope. And even when treatment is started, whether surgery, radiation, or hormone therapy, side effects like incontinence or erectile dysfunction can deeply affect a man's quality of life. But there is hope. Absolutely. In fact, this is one area of cancer research making great strides. Prostate-specific antigen, PSA, blood tests, and digital rectal exams have helped doctors catch prostate cancer earlier than ever before. Newer tools like MRI scans and genetic testing are helping doctors distinguish slow-growing tumors from aggressive ones, so patients don't undergo unnecessary treatment. And advances in immunotherapy and targeted therapy are giving men with advanced prostate cancer more time and more quality in their later years. When the cancer has progressed significantly, prostatectomy, which is the removal of the prostate gland, is usually done as a treatment option. So when we talk about prostate cancer, it's not just about numbers on a chart. It's about fathers, brothers, uncles, grandfathers, and even young men whose lives are suddenly turned upside down. So here's a question for you. If you or someone you love is at risk, would you wait for symptoms to show up or take action with regular checkups? While you answer that, let's move to the next cancer on our list. Number 7, pancreatic cancer. Pancreatic cancer is often described as one of the most silent and unforgiving killers out there. So what exactly is pancreatic cancer, and why does it claim so many lives every year? Let's have an overview. The pancreas is a small organ located deep in the abdomen, sitting just behind the stomach. Most of us don't think about it until it fails. Its main functions are to aid in digestion by producing enzymes that break down food, and to regulate blood sugar by producing hormones such as insulin and glucagon. Its exocrine role involves releasing digestive enzymes into the small intestine, while its endocrine role involves secreting hormones directly into the bloodstream to manage glucose levels. Because the pancreas is hidden so deep inside the body, tumors can grow quietly, without any obvious symptoms, for a long time. By the time warning signs appear, the cancer has usually already spread. What are the warning signs? Most people might experience jaundice, unexplained weight loss, or abdominal pain. It's almost like a fire smoldering inside a locked room, invisible until the smoke finally leaks out. By then, the damage is already severe. So why is pancreatic cancer considered one of the deadliest? The biggest reason is late diagnosis. Early-stage pancreatic cancer rarely shows symptoms, so most patients are only diagnosed when the disease has advanced, making treatment options limited. And unlike some cancers that grow slowly, pancreatic cancer is known for its aggressive spread. It can quickly move into nearby organs, blood vessels, and lymph nodes, making surgery, which is the most effective treatment option, nearly impossible in many cases. So, while other cancers might give doctors months or even years of lead time to intervene, pancreatic cancer often gives just a few weeks or months of warning before becoming life-threatening. That's what makes it so terrifying. Looking at the key stats, they are sobering. According to the World Health Organization and the American Cancer Society, over 495,000 new cases are diagnosed globally every year. Nearly 466,000 deaths are recorded annually, which means most people diagnosed with pancreatic cancer don't survive long after. The 5-year survival rate in many countries is only around 10%. Compare that with breast cancer or prostate cancer, which can have survival rates above 90% when caught early. Could you imagine? Out of 10 people diagnosed, only 1 may still be alive 5 years later. That reality hits hard. Who is at risk? Pancreatic cancer doesn't discriminate, but certain factors raise the chances. Family history plays a role. If a parent or sibling had it, your risk increases. Genetics matter, but lifestyle is also a huge contributor. Smoking is one of the strongest risk factors, accounting for about 25% of cases. Obesity, chronic pancreatitis, and diabetes also add to the danger. And what makes it even more complicated is that sometimes people with no known risk factors still contract it. That unpredictability is part of what makes this disease so feared. So the question is, if it can strike both the careful and the careless, how do we ever stay ahead of it? That question takes us to notable research advances. Researchers are developing new methods to detect pancreatic cancer at an earlier stage. Blood tests that can identify tumor markers, advanced imaging techniques, and even AI-powered diagnostics are showing promise in spotting the disease before symptoms appear. On the treatment side, targeted therapies and immunotherapies are being tested in clinical trials. These approaches aim to attack the cancer more directly, sparing healthy cells and improving survival rates. In fact, over the last few years, new drug combinations have extended survival times for some patients, not by decades, but by crucial months and years, allowing families more time together. It may not be the cure yet, but it is progress. And progress means hope. If only we could tackle the main issue, which is late diagnosis. If not, by the time it's found, surgery, the only potential cure, won't be an option for most patients because the cancer has already spread. Chemotherapy and radiation may help slow progression, but they rarely stop it entirely. Even when surgery is possible, the procedure, called the Whipple operation, is incredibly complex, involving the removal of parts of the pancreas, stomach, and intestine. It's risky, and recovery can take months. And even after successful surgery, there's still a high chance of the cancer coming back. So the challenge isn't just about treating the tumor, it's about the biology of the disease itself. Pancreatic cancer cells are resistant, stubborn, and fast-moving. Number 6. Esophageal cancer. When we eat or drink, we rarely think about the simple act of swallowing. It feels so natural, almost automatic. But what if that everyday action suddenly became painful, difficult, or impossible? For thousands of people every year, that's their cruel reality because of esophageal cancer. What is it? Where does it develop? The esophagus, also called the food pipe, is a long muscular tube that carries food and liquids from the mouth down into the stomach. It's something we rely on constantly, without giving it a second thought. Esophageal cancer develops when malignant cells form in the lining of this tube. This can cause difficulty swallowing and unintentional weight loss. There are two main types: squamous cell carcinoma, which usually starts in the upper and middle parts of the esophagus, and adenocarcinoma, which often begins near the lower end, closer to the stomach. At first, these cancers can grow silently, and over time, they narrow the esophagus, making swallowing, one of the most basic human functions, extremely difficult. Now imagine how frightening it must feel, sitting at dinner with your family, unable to swallow even a sip of water without pain. That's the harsh reality for many patients. Why is esophageal cancer considered one of the most dangerous cancers in the world? Esophageal cancer is usually diagnosed late because early symptoms like heartburn or indigestion look minor to most people. By the time severe symptoms appear, the cancer has often spread aggressively to nearby organs, such as the lungs and major blood vessels. As a result, survival rates are very poor, leaving patients and families with limited options. Looking at the statistics, they tell a grim story. According to the World Health Organization and the American Cancer Society, over 600,000 new cases of esophageal cancer are diagnosed worldwide each year. Tragically, there are more than 540,000 deaths annually. That's nearly 9 out of 10 patients. The 5-year survival rate in many regions hovers between 15% and 20%. To put that into perspective, out of 100 people diagnosed, only around 15 may still be alive 5 years later. Numbers like these are the reason esophageal cancer ranks among the top killers globally. So, who is most at risk? Several lifestyle and environmental factors make esophageal cancer more likely. Smoking and heavy alcohol use are two of the biggest culprits, especially for squamous cell carcinoma. Long-term irritation of the esophagus, like from acid reflux or a condition called Barrett's esophagus, significantly raises the risk of adenocarcinoma. That's not all. Obesity also plays a role, increasing pressure on the stomach and leading to more acid reflux. Diets low in fruits and vegetables and high in processed foods may also add to the danger. There are also genetic factors. People with a family history of esophageal cancer or inherited conditions affecting the digestive tract face higher risks. But here's the unsettling truth. Not everyone with these risk factors develops cancer. And sometimes, people with no clear risk at all still do. That unpredictability makes the disease even scarier. But the notable research/advances show glimmers of hope. Researchers are working on new screening methods to catch esophageal cancer earlier. Endoscopies are becoming increasingly advanced, featuring high-definition imaging and even AI-assisted detection to identify precancerous changes that the human eye might miss. In treatment, there's progress too. Minimally invasive surgeries are reducing recovery times. Targeted therapies, which are drugs that attack specific cancer cells without damaging as many healthy ones, are being tested. And immunotherapy, which harnesses the body's own immune system to fight cancer, has shown promise in clinical trials. These advances may not yet have turned the tide completely, but they are creating glimmers of hope where once there was almost none. Esophageal cancer is about families who face one of the toughest diagnoses out there. And it's about the urgent need for awareness, prevention, and research. Maybe one day, instead of being a near-certain death sentence, esophageal cancer will be something that can be caught early, treated effectively, and survived. Until then, knowing the risks, recognizing the symptoms, and supporting ongoing research are the best weapons we have now. Number 5. Stomach, gastric, cancer. Stomach cancer is sometimes called gastric cancer. It is a disease that quietly takes hundreds of thousands of lives every year. When we sit down to eat, we rarely think about the stomach as anything more than a container for our food. But this powerful organ is constantly at work, breaking down what we eat, absorbing nutrients, and fueling the body. Now, imagine this vital organ slowly turning against you, developing a silent disease that's often discovered far too late. That's the terrifying reality of stomach cancer. So, how does it develop? It begins when abnormal cells in the stomach's lining start to grow uncontrollably. Over time, these cells form a tumor that can invade deeper into the stomach wall and spread to nearby lymph nodes, the liver, or other parts of the body. There are different types, but the most common is adenocarcinoma, which starts in the cells that line the innermost layer of the stomach. Other, less common types include lymphomas, gastrointestinal stromal tumors, GISTs, and carcinoid tumors. At first, stomach cancer may look a lot like ordinary digestive issues, indigestion, mild nausea, or bloating. But behind those subtle signs, something far more dangerous can be developing. Now, could you imagine ignoring what feels like simple heartburn, only to discover months later it was cancer growing inside you? That can be distressing. Now we know what it is. Why is stomach cancer so dangerous? The main reason is late diagnosis, as we have previously mentioned in other types of cancer. Early stomach cancer rarely causes dramatic symptoms. People may mistake it for ulcers, acid reflux, or even food poisoning. By the time other symptoms like weight loss, vomiting of blood, or severe pain appear, the cancer is often already advanced. Another factor is how aggressively it spreads. The stomach is connected to a rich network of lymph nodes and blood vessels, meaning malignant cells can travel quickly to the liver, pancreas, or lungs. Unfortunately, many patients are diagnosed at a stage where management is no longer possible. Now, let's look at the statistics. According to the World Health Organization, stomach cancer is the 5th most common cancer worldwide. Each year, there are over 1 million new cases. Tragically, it ranks as the 5th leading cause of cancer deaths, killing more than 770,000 people annually. The 5-year survival rate also varies widely. In countries with advanced screening like Japan and South Korea, survival rates can reach 60% or more. But in many other parts of the world, it's far lower, often under 30%. So, out of 100 people diagnosed, more than 2/3 may not survive beyond 5 years. Those numbers are staggering. So, who's most at risk of developing stomach cancer? One of the biggest culprits is a bacterial infection called Helicobacter pylori, H. pylori for short. It's incredibly common worldwide and can cause chronic inflammation of the stomach lining, leading to ulcers, and over time, cancer. Diet also plays a major role. Diets high in salty, smoked, or pickled foods increase the risk, while diets rich in fresh fruits and vegetables seem to lower it. Lifestyle factors like smoking and heavy alcohol use further raise the risk. Obesity and lack of exercise also add to the burden. And then there are genetic factors. People with a family history of stomach cancer or inherited conditions like hereditary diffuse gastric cancer face a much higher risk. It's unsettling, isn't it? To know that something as ordinary as the food you eat or a bacteria you didn't even know you had could silently plant the seeds of a deadly disease. This takes us to the treatment challenges. The biggest challenge is catching it early. Because symptoms mimic everyday digestive problems, diagnosis often comes when the cancer is already advanced. Surgery, usually removing part or all of the stomach, remains the main treatment. But it's not always possible if the cancer has spread too far. Even when surgery is successful, it requires a life-altering adjustment, learning to eat in smaller portions, facing nutritional challenges, and coping with long-term side effects. Chemotherapy and radiation can help, but their effectiveness is limited once the disease has spread. On the treatment front, new targeted therapies such as HER2 inhibitors and immune checkpoint inhibitors are offering fresh hope for patients whose cancers don't respond to traditional therapies. Researchers are also working on ways to detect stomach cancer earlier through blood tests, breath analysis, and even AI-powered imaging tools. These advances may not have solved the problem yet, but they're building a future where stomach cancer might one day be caught early and treated effectively. Number 4, breast cancer. For many people, the word cancer itself is frightening. But when you add the word breast before it, it hits differently. Why? Because breast cancer is not just a medical condition, it's deeply personal. It's tied to identity, motherhood, and family. Nearly everyone knows someone, a mother, a sister, a friend, who has faced this disease. So, what exactly is breast cancer? It begins when cells in the breast grow abnormally, multiplying in ways the body can't control. These cells often form a tumor that can be felt as a lump, and it can spread silently. Most breast cancers start in the ducts that carry milk to the nipple. This type is known as ductal carcinoma, or it can start in the lobules that produce milk. This type is known as lobular carcinoma. But regardless of where it starts, the danger lies in its ability to spread to other parts of the body, like the bones, liver, lungs, or brain. Why is breast cancer so dangerous? On one hand, it's one of the most well-known cancers. We hear about it in campaigns, awareness walks, and pink ribbons. But despite this awareness, breast cancer can still be deadly, especially when diagnosed late. The disease doesn't always show clear early symptoms. Some tumors grow quietly without pain or obvious lumps. And in aggressive forms, like triple-negative breast cancer, it can spread quickly and resist common treatments. What makes it even more devastating is that it often strikes women in the prime of their lives, who are balancing careers, families, and their future. Did you know that men can get breast cancer too? Yes, they can. Even though men don't have the same amount of breast tissue as women, they do have small amounts of breast cells and ducts right behind the nipples. These cells can undergo the same changes as women's breast cells, including becoming cancerous. Estrogen, a hormone present in both men and women but higher in women, stimulates breast cell growth. In rare cases, men can have higher levels of estrogen due to obesity, liver disease, genetic conditions, or certain medications, which increases their risk of breast cancer. Although it's far less common, that makes diagnosis in men even more delayed and dangerous. Now, let's look at statistics. According to the World Health Organization, breast cancer is the most common cancer worldwide. Each year, there are more than 2.3 million new cases. Tragically, it is also the leading cause of cancer death among women, killing over 685,000 women every year. The 5-year survival rate varies widely. In high-income countries with access to early detection and treatment, survival can be as high as 90%. But in low and middle-income regions, survival rates can drop to around 40% or less. What are the risk factors? The first is being a woman. This might sound obvious, but it matters. Simply being female is the biggest risk factor, since women naturally have more breast tissue and higher exposure to estrogen and progesterone hormones, which influence the growth of breast cells. Some risk factors can't be controlled. For example, age plays a big role, as most breast cancers are diagnosed after 50 years. Family history is another. If your mother, sister, or daughter had breast cancer, your risk is significantly higher. Inherited genetic mutations, such as those in the BRCA1 and BRCA2 genes, significantly increase the risk. But lifestyle also matters. Drinking alcohol regularly, being overweight, lack of exercise. Environmental and reproductive factors also come into play. It's a complex picture, isn't it? Some risks you inherit, while others you might unintentionally invite through everyday habits. But even with all the awareness campaigns, why is breast cancer still such a formidable enemy? Because it's not one disease, it's many. Breast cancer comes in several subtypes, each behaving differently. Some respond well to hormone therapy, while others don't. Some are slow-growing, while others, like triple-negative breast cancer, are aggressive and resistant. Treatment can be physically and emotionally draining. Surgery, radiation, chemotherapy, targeted therapies. They save lives, but they also come with side effects like fatigue, hair loss, pain, and long-term impacts on fertility and overall health. And beyond the physical, there's the psychological toll. The fear of recurrence, changes in body image after mastectomy, and the stress of lifelong monitoring can weigh heavily on patients and their families. But here's the part that brings hope. Over the past 2 decades, advances in screening and treatment have saved millions of lives. Mammography remains a key tool for early detection, and newer imaging technologies are making it even more accurate. You might wonder what mammography is. It is a special type of X-ray test used to take pictures of the breast. It helps doctors look for early signs of breast cancer, often before a woman feels a lump or has any symptoms. During the test, the breast is gently pressed between 2 plates to spread out the tissue. This allows the X-ray to capture clearer images of the inside of the breast, showing any unusual spots, calcifications, or lumps. A mammogram is strongly recommended by many health organizations for women aged 40 and above because it can detect cancers up to 2 years before they can be felt by hand. It is also the gold standard for breast cancer screening worldwide. In addition to mammography, targeted therapies like HER2 inhibitors have revolutionized treatment for specific breast cancers, while immunotherapies are being studied for aggressive types. Genetic testing for mutations like BRCA1 and BRCA2 has given people the power to take preventive measures, including increased screening or even risk-reducing surgeries. And global awareness campaigns have helped break down stigma, encouraging more women to check themselves, go for screenings, and talk openly about their health. Yes, breast cancer is dangerous, but awareness, early detection, and advancing science give us reasons to hope. And maybe, just maybe, the next generation will live in a world where breast cancer is no longer feared, but routinely defeated. Number 3, liver cancer. At number 3, we come to liver cancer, one of the deadliest cancers worldwide, especially in Asia and Africa. The liver is a powerhouse that filters toxins, processes nutrients, stores energy, and keeps the body in balance. It's the ultimate multitasker. The chilling truth is that when cancer strikes the liver, it can be one of the deadliest diagnoses a person can face. Here is what you should know. There are a few types, but the most common is hepatocellular carcinoma, HCC. This begins in the hepatocytes, the main liver cells. Other types include intrahepatic cholangiocarcinoma, which develops in the bile ducts inside the liver, and angiosarcoma, which originates in the liver's blood vessels, though those are much rarer. The liver's unique job makes it especially vulnerable. Think about it. Everything you eat, drink, and swallow eventually passes through this organ. It acts as the body's filter, but that also means it's constantly exposed to toxins, viruses, and metabolic stress. When cancer develops here, it has easy access to the bloodstream and lymphatic system, giving it plenty of opportunities to spread. Why is liver cancer dangerous? It is most often diagnosed late. In the early stages, liver cancer usually causes no obvious symptoms. A patient may feel a little tired, lose some weight, or dismiss abdominal discomfort as indigestion or stress. By the time more serious signs appear, like jaundice, which is the yellowing of the skin and eyes, swelling in the abdomen, or severe pain, the cancer is usually already advanced. The second reason is aggressive progression. Liver cancer spreads quickly, often moving into nearby blood vessels or metastasizing to the lungs and bones. And here's the kicker. Many patients with liver cancer already have underlying liver disease, such as hepatitis or cirrhosis. This makes treatment much harder because doctors aren't just fighting the tumor, they're fighting against a damaged liver that's struggling to function in the first place. But how serious is liver cancer on a global scale? Let's look at the numbers. According to the World Health Organization, every year, more than 900,000 people are diagnosed. It's responsible for nearly 830,000 deaths annually. The 5-year survival rate remains alarmingly low. In most countries, it's just 15 to 20%. In advanced stages, survival can drop to single digits. So, out of every 10 people diagnosed, only 1 or 2 will still be alive in 5 years. Those odds make liver cancer one of the deadliest cancers in existence. What are the risk factors, and who is at risk? One of the most significant risk factors is chronic viral hepatitis, particularly hepatitis B and hepatitis C. These infections cause long-term inflammation and scarring that can eventually transform into cancer. In fact, in many parts of Asia and Africa where hepatitis B is common, liver cancer rates are among the highest in the world. Another major factor is cirrhosis, which is essentially severe scarring of the liver. This condition can be caused by years of heavy alcohol use, non-alcoholic fatty liver disease linked to obesity and diabetes, or chronic infections. Other risks include smoking, long-term exposure to toxins like aflatoxins, which is a mold that contaminates improperly stored grains and nuts. Then we have inherited conditions like hemochromatosis, where the body stores too much iron. Another sobering truth is that lifestyle diseases like obesity and diabetes, which were once not strongly associated with liver cancer, are now driving up cases worldwide. Now let's talk about why treating liver cancer is so challenging. The first hurdle is that many patients are diagnosed too late for curative options. Surgery, where part of the liver is removed, or a liver transplant can save lives, but only if the cancer is caught early and hasn't spread. But there's another catch. The liver is one of the few organs in the body that can regenerate. Sounds like an advantage, right? But when the liver is already scarred or damaged by cirrhosis, removing part of it can be risky. Many patients simply aren't healthy enough to withstand the surgery. For advanced cases, chemotherapy is often less effective against liver cancer compared to other cancers. Targeted therapies like sorafenib and lenvatinib have extended survival for some patients, but usually only by a matter of months. Immunotherapies are promising, but they don't work for everyone. But amidst the grim statistics, research advances give us rays of hope. The hepatitis B vaccine has already prevented millions of potential future cases, especially in countries where the virus is widespread. Hepatitis B virus, HBV, is a leading cause of chronic liver infection. When someone is infected, the virus can stay in their liver for years, causing ongoing inflammation and cirrhosis. Over time, this damaged liver tissue becomes a fertile ground for the development of hepatocellular carcinoma. On the treatment side, new antiviral drugs like direct-acting antivirals, DAAs, can now cure hepatitis C, drastically lowering the risk of liver cancer for those patients. Researchers are developing liquid biopsies, which are simple blood tests that could detect liver cancer much earlier than current imaging techniques. So while the fight against liver cancer is far from over, science is slowly turning the tide. Here is an important message you should not forget. 1. Get tested for the hepatitis virus. 2. Get vaccinated against hepatitis B. 3. Even if you feel healthy today, you could still be at risk of exposure through everyday activities, especially in places where hepatitis B is common. 4. Reduce alcohol intake and smoking, and even exposure to secondhand smoke. If we adhere to these, and maybe, one day, liver cancer will no longer be a death sentence, but just another disease we've learned how to beat. Number 2. Colorectal cancer. How did you feel when you heard colorectal as the number 2? Surprised? Colorectal cancer is cancer of the colon or rectum. It's like a silent predator, unnoticed, underestimated, and often discovered far too late. It develops in the colon, the longest part of the large intestine, or the rectum, which is the final stretch before waste leaves the body. Most cases begin with small growth called polyps. They're usually harmless at first, but some of them slowly transform into cancer over time. And unless they're spotted and removed early, they can develop into full-blown colorectal cancer. The unsettling truth is that many people don't even know these polyps are there. You don't feel them, they don't cause pain, they don't make themselves obvious until it's too late. So let me ask you, when was the last time you thought seriously about what's happening in your colon? For most of us, probably never. Now let's look at why colorectal cancer is dangerous and ranks so high. First, it's a master of disguise. In its early stages, colorectal cancer often shows no clear symptoms, just like most of the cancers in our list. Even when signs appear, like occasional blood in the stool, stomach discomfort, or changes in bowel habits, people brush them off as minor digestive issues. After all, who hasn't had stomach troubles now and then? But this is where the danger lies. By the time someone realizes something serious is going on, it might be too late. And once it spreads beyond the intestine to organs like the liver or lungs, treatment becomes much more difficult. Let's bring in some numbers to understand the full scale of this cancer. According to the World Health Organization, colorectal cancer is the third most commonly diagnosed cancer worldwide. Every year, around 1.9 million people hear those dreaded words. You have colorectal cancer. It doesn't stop there. This disease causes nearly 900,000 deaths annually, making it the second leading cause of cancer-related deaths. Now here's the twist. If detected early, The 5-year survival rate is close to 90%, but if diagnosed late, when it has spread, survival plummets to around 14%. But who's really at risk of developing colorectal cancer? Well, it's not just one group. Risk spreads across genetics, lifestyle, and health conditions. If you have a family history of colorectal cancer, your odds are higher. Conditions like Lynch syndrome make the risk even greater. Thank you for asking. Lynch syndrome is a genetic condition that increases a person's risk of developing several types of cancer, especially colorectal cancer and endometrial, uterine cancer. It happens when someone inherits a mutation in one of the genes responsible for repairing DNA errors, called mismatch repair genes. Lynch syndrome is also known as hereditary non-polyposis colorectal cancer, HNPCC. Another risk factor for colorectal cancer is age. Most patients are over 50, but the alarming part is that cases among younger adults are climbing steadily. Doctors don't fully know why, but lifestyle changes in diet could play a role. High consumption of red or processed meats, low fiber intake, sedentary habits, smoking, and alcohol all increase the risk too. And finally, people with inflammatory bowel diseases like Crohn's or ulcerative colitis are also more vulnerable. So ask yourself, how many of these factors line up with the way we live today? Fast food on the go, sitting for hours at desks, less exercise, and more alcohol. It's almost like modern life is feeding this cancer. You might be wondering if there are treatments, right? The answer is yes, but it's complicated. In the early stages, surgery can be life-saving. Doctors can remove the cancer, sometimes even just by removing the polyp before it turns deadly. But in later stages, the picture changes. Treatment might involve surgery combined with chemotherapy, radiation, or targeted therapy. These treatments can slow progression and extend life, but they're rarely curative once the cancer has spread. Another huge challenge is access to screening. In wealthier countries, colonoscopies and stool tests are common and catch the disease before it's too late. But in many parts of the world, people don't have access to these tools. By the time they walk into a clinic, the cancer is already advanced. Here are the notable research areas that are making strides in both prevention and treatment. 1. Screening tools are improving. Less invasive tests like advanced stool kits make it easier for people to get checked without the fear of a colonoscopy. 2. Immunotherapy is showing promise, especially for patients with specific genetic markers. Immunotherapy teaches the body's own immune system to fight back against the cancer. 3. Targeted therapies are being developed that block the cancer's growth signals while sparing healthy cells. 4. Public awareness is growing. Campaigns are encouraging people to talk openly about colon health, breaking down stigma, and saving lives through early detection. Colorectal cancer may not be the loudest, flashiest, or most talked about cancer, but that's exactly what makes it so deadly. It hides in silence, grows unnoticed, and strikes when it's already strong. But the lesson here is clear. This cancer can be stopped with early detection, healthy lifestyle changes, and better access to care. So if you notice blood in your stool, sudden changes in digestion, or unexplained weight loss, don't ignore it. Don't dismiss it as just something you ate. Your body could be giving you a warning. At the end of the day, survival isn't just about medicine. It's about listening to your body, getting checked in time, and never underestimating the silent dangers we can't see. Because when it comes to colorectal cancer, time is everything. Number 1, lung cancer. Wonder why lung cancer is at the top of our list? It is primarily due to its strong link with tobacco use. This disease has taken more lives than almost any other cancer. It doesn't just show up in the statistics, it shows up in families, in stories, and in the lives it leaves changed forever. It starts in the lungs, the two sponge-like organs in our chest that make every breath possible. These lungs, our lifeline for oxygen, can develop abnormal cells that grow uncontrollably, forming tumors that interfere with breathing and eventually spread to other parts of the body. But here's the chilling part. We can't see or feel lung cancer in its early stages. Most people don't notice anything until it's already advanced. And by then, it's often much harder to treat. So why does lung cancer top this list of the most dangerous cancers? Because it has a deadly combination. It's common, aggressive, and usually diagnosed late. The symptoms, things like a persistent cough, shortness of breath, chest pain, or coughing up blood, often don't appear until the disease is already advanced. By then, the cancer may have spread to the brain, bones, or liver. Looking at the statistics, lung cancer is the leading cause of cancer death worldwide. Every single year, it takes around 1.8 million lives. That's more than breast, prostate, and colon cancer combined. Each year, more than 2.2 million new cases are diagnosed globally. The overall 5-year survival rate for lung cancer hovers around 20%. But if it's caught early, before it spreads, survival can jump up to 60% or more. Who's really at risk of lung cancer? Of course, the #1 cause is smoking. Cigarettes, even secondhand smoke, all of these expose the lungs to toxic chemicals that damage cells and trigger cancer. In fact, smoking is linked to nearly 85% of all lung cancer cases. But here's what many don't realize. You don't have to smoke to get lung cancer. Air pollution, especially in big cities, can raise the risk. Exposure to radon gas, asbestos, or other industrial chemicals is another trigger. And let's not forget genetics. If lung cancer runs in the family, your risk is higher too. So the hard truth is, while smoking is the main culprit, lung cancer doesn't discriminate. It can reach anyone. You might be asking, with modern medicine, why is lung cancer still so deadly? The biggest challenge is late diagnosis. By the time most people find out they have lung cancer, it's already at stage 3 or 4. At that point, surgery isn't always possible, and treatments like chemotherapy, radiation, and immunotherapy are focused more on extending life than curing the disease. Another challenge is the aggressive nature of the cancer. Lung cancer cells spread quickly through the bloodstream and lymph system, making it harder to contain. So even after treatment, recurrence is common. Many patients go into remission, only for the cancer to return months or years later. Now, despite all of this, all hope is not lost. Low-dose CT scans are being used more often for screening people at high risk, such as long-term smokers. These scans can detect tumors earlier, before symptoms even appear. Immunotherapy drugs are teaching the body's own immune system to recognize and fight cancer cells more effectively. Targeted therapies are being developed that focus on specific genetic mutations in lung cancer cells, giving patients more personalized treatment options. And let's not overlook the power of prevention. Public health campaigns against smoking have already saved millions of lives and continue to save more every day. So while lung cancer remains the deadliest cancer in the world, science is pushing back harder than ever before. If more people had access to screening, if smoking rates continued to fall, if treatments kept improving, the story of lung cancer could be rewritten. So if you have a persistent cough, chest pain, or unexplained shortness of breath, don't ignore it. Don't brush it off as just the flu or just stress. Get it checked. Because with lung cancer, every moment matters. And sometimes the difference between life and death is not about how strong the cancer is, but how quickly we act. We've just journeyed through the 10 deadliest cancers in the world, from leukemia and pancreatic cancer, all the way to lung cancer. Behind these numbers are families, communities, and lives forever changed. But the truth is that early detection, awareness, and healthy choices can save lives. Screening, vaccinations, quitting smoking, healthy diets, and listening to our bodies make a powerful difference. If this video has opened your eyes, don't keep it to yourself. Share it, talk about it, And most importantly, take action for your own health. If you have any personal experience with any of these cancers, questions, or concerns, let us know in the comments. Thank you for watching. Stay safe, stay informed, subscribe to our channel, and we'll see you in the next video.